As we continue on the conversation of health crises, unfortunately, we had the coronavirus discussion a little bit. And I know, Secretary, that you will understand I'm going to talk to you again about Lyme disease and tick-borne illness. Yourself and your staff have had many meetings with me in regards to this issue and my concerns. And it definitely is still a very serious and growing concern in Pennsylvania. Some of the most recent numbers I've seen have shown there's been a 300% increase in Lyme disease in the northeastern states. So it is something that I believe we really have made some progress on together, and we are moving forward. But the East Stroudsburg University Tick Lab, which we established the free tick testing program 2 years ago and actually put in the line item last year, has had some great results. And I just wanted to point those out just for the record and for the members that since April of 2019 to February 24th of this year, there's been 12,333 ticks that have been tested. Of those ticks tested, 51.5% of them tested positive for either Lyme disease, babesiosis, or anaplasmosis. So that's over half, obviously. And so there's a great concern. But it's providing some wonderful information for us as far as for the patient-doctor relationship as a tool. And it's also giving us some pathogen information and science information that we need. What's concerning to me is as I see that need and I see the proposed budget by the governor having the $3 million moved down to $2.5 million. Your thoughts on that?
Sure. So you are correct. Lyme disease continues to be a very significant public health problem here in Pennsylvania, and we've been very pleased to collaborate with your office and to collaborate with East Stroudsburg. I believe that the 2.5 is exactly the same as the governor put into the budget last year, and I believe that through legislative additions in your office, the extra $500,000 was added. And I think it was added to DHS's budget the first year and last year to our budget. So we'd be pleased to, the budget it's just a starting point. We'd be pleased to collaborate with your office, and if you and the legislature add that $500,000 for continuing to work with East Stroudsburg University, we will renew that contract, and we're very pleased to continue to work with them because they're doing great work.
They are doing great work, which is why I'm surprised why this would be pulled out, so to speak. Can you give me some more details why it was pulled out?
I don't think that there was any specific reason why it was pulled out. I think that last year it was a legislative ad, so the expectation might be that this year it's a legislative ad. But there was no specific policy reason why that contract was not included.
Right. So are we continuing to have conversations with East Stroudsburg University, with the Department of Health, with DEP in a combined effort?
Yes.
Okay.
They have received or are receiving that money through our process, and all that contract was worked out. And we'd be pleased to do that again. I don't think there was no specific, again, policy initiative why that specific money wasn't included. I think that the expectation might be that it'll be the same as last year and as a legislative addition.
Okay, so there would be no conversations that the $500,000 could come out of the $2.5 million that's currently allocated?
That would limit our ability to use that money for our continued activities. So right now, that money is going towards surveillance. It's going towards prevention and education. An accounting would be $942,000 to education and outreach, $118,000 for testing capabilities, $423,000 for planning and prevention, the $500 to East Stroudsburg, as you mentioned, $912,000 for surveillance. That includes work with DEP in terms of their tick surveillance, in terms of numbers of ticks in different counties, and $105,000 for administration. So that's the $3 million. If you take $500 out of the 2.5, then some of that activity will be less.
Do you know for the tick testing that the DEP or the surveillance that they are doing, is there any replication or anything there that we might not need to do the DEP surveillance in that manner, and we could utilize the testing that East Stroudsburg University is doing on the surveillance?
I'd have to go back to my staff and talk about some of the details of the DEP surveillance. I've seen them do their tick. I mean, they're often looking for the numbers of ticks in different counties, which is not something that East Stroudsburg would be doing. Right. So they're not, my understanding is they're not so much testing the tick as they are doing surveillance of the tick population. But I'd have to get details from my staff and get back to your office.
Okay. Thank you, Madam Secretary.
Thank you.